and knowledge among its peers in the diabetic arena. Today, this RSSDI social bias for the last 3 months, we do it every Thursday. And today we have two esteemed guests with us on the show who are going to talk about diabetes and hypertension. At the outset, I would thank Dr. Professor R.V. Jaikumar. He's a very familiar and a senior most endocrinologist in this country. He's a past president of the same organization which I'm talking, that is RSSDI. He's the founder president of the Indian Thyroid Society, the first endocrinologist from the state of Kerala. He had a lot of publications to his credit. There's a lot to talk about him, but I'll keep it short. He's one of the senior most person you can listen to on diabetes and hypertension. Then we have Dr. Shailaja Kale. Dr. Shailaja Kale runs the Shailaja Kale Diabetes and Specialty Clinics from Pune. And she's one of the senior most diabetologists from Pune, was on various publications to her credit. Me and Dr. Shailaja are friends for a long time, keep meeting, bumping into research meetings always. And thank you, Dr. Shailaja. And also she's the chairman-elect for the Maharashtra chapter of the RSSDI. I think Dr. Kamlakar Tripathi is joining, another guest, and she's going to moderate the show for us today. Then we have Dr. Kamlakar Tripathi, who's going to join in shortly. Dr. Kamlakar Tripathi is professor of medicine. He's a nephrologist, DM nephrology from the Benares Hindu University Institute of Medical Sciences. He's also a key opinion leader with RSSDI. He writes various chapters on nephrology and diabetes and hypertension in the RSSDI textbooks, and has a lot of publications to credit. He's a very active academician. So I welcome him to the show. I would ask Dr. Shailaja Kale to take on the next 1 hour on diabetes and hypertension. And over to you, Dr. Shailaja.
Yes. Thank you very much, Dr. Sanjay, for that very nice introduction. I am welcoming each one of you who are joined already and who are going to join. Let me congratulate Research Society for Diabetes in India team to have this great initiative where we are directly the great people like today's esteemed faculty, Dr. R.V. Jaikumar from Kerala and Dr. Kamlakar Tripathi from Benares. They are really a senior and most respected endocrinologist from our country. And Dr. Tripathi is also specialized in kidney problems and diabetes. So we have these two great persons, two great speakers, two experts to answer all your questions. So be ready and have all your questions, whatever you want. You will get all your queries resolved today, I promise you. And at the end of the program, I'm sure you will take some good take-home message, which you will use it in your daily life and change it for a betterment of your health from, I will say not tomorrow, from tonight after our program. Again, one more, we are very lucky and happy that we have this subject of diabetes and blood pressure, which is, I think, a most important aspect of diabetes is your blood pressure. You will be surprised, but let me explain it to how. That's what we are going to discuss today. So I know blood pressure is very keen and close to everyone's heart. Everyone wants to check the blood pressure. Nowadays, it has increased. The COVID times has taught us a lot, and at the same time, we are having a different life. Like today, I am from Pune, Dr. Jaikumar from Kerala, Dr. Tripathi from Benares, and Dr. Sanjay from Bangalore. We all are talking to you simultaneously, which was not seen a few months back. So definitely, I'm going to enjoy the session today very much. I think, Dr. Jaikumar, let's start today's session for diabetes and hypertension or blood pressure. Sir, you are mute. Yeah.
Yes.
Should we start? Yes. So I think people are wondering what is the relation. So let us first get to see that what is the importance of blood pressure in a person's life and how the diabetes is a vascular disease. So my first question to Dr. Jaikumar
Okay.
is the diabetes actually a disease of blood vessels or sugar? At the same time, I would like to welcome Dr. Bansi Sabu, President Research Society for Study of Diabetes in India. And I already congratulated Bansi, you and your team for this great initiative. So
Thank
welcome
you.
to be a part of today's discussion. Are you going to be a part of today's discussion?
Yes, I'll be there. But I think
Perfect.
primarily you
Network
discuss with
problem.
Dr. R.V. Jaikumar, who is our past president,
Yes.
and when you feel that I can be always there, but primarily it is the discussion between you and Dr. R.V. Jaikumar. And Sanjay
Perfect.
Reddy is there from our Rssdi ECT. I normally
Yes.
just attend the program.
Yes, thank you so much. So he's keeping a check, huh, Sanjay?
No,
What
I'm
which
not
people
taking
are
the
doing.
check. I just want to be a part of it.
No. Thank you so much.
Thank you.
So yes, Dr. Jai. Yes, Dr. Jai
Dr.
Kumar.
Tripathi is joining us shortly.
Yes. So can you just
There
elaborate
is some
about how
problem with
blood
audio.
vessels are affected in diabetes? Please go ahead, sir.
Okay, I think there is some problem with the audio. I was not able to hear the question completely. But what I understand is you want to know why this hypertension diabetes combination and what is the importance. As you know, our country after independence, the first health action taken by the government was to control the communicable diseases. So now it is almost under good control. Now, then they started looking at the non-communicable diseases. And the major non-communicable diseases is the diabetes. And along with the cousin brothers, I always say that when you have got a diabetes, you get the other cousins will be waiting to get in at the earliest time. The cousins are one is hypertension, other is hypercholesterolemia, then ischemic heart disease, like that it goes. So many cousins are there. So what is the importance is this: majority of diabetic patients will have an associated other non-communicable disease like hypertension at the very earliest time. So it is all the more important that all the physicians must be aware of this combination, looking for the combination of these two non-communicable cousins, which is going to destroy the health, and take
Yes, sir.
measures
So
to control these two things. And you must, the physician must be well aware that you have to control both the disease. When you select a drug for diabetes management, that must be friendly with the hypertension management. And when you take a drug for select a drug for hypertension, that must be going hand in hand with the so very important to know these two diseases, so that the physician must be able to make the correct judgment in correcting the correct drug combination, diabetic drug for the hypertensive patient and the hypertensive drug for the diabetic patient, so that you must be knowing. And second thing is, these two are the main backbone, or the fertilized sand for the ischemic heart disease, the vascular disease, atherosclerotic heart disease, and the atherosclerotic peripheral diseases. All this is the fertile soil. If you have got somebody has got a diabetes and hypertension, the chance of that this the atherosclerotic vascular disease is the fertile land for it to grow. So all the more important that you must pay all the attention to both these non-communicable diseases, which are seen in association. If you look at the statistics, I think Dr. Kale may be having the statistics with that how many people with stroke, about 57% of people with stroke will have hypertension, about 25 to 30% with ischemic heart disease will have hypertension. So like that, so many statistics are there.
Cinemas.
But all said and done, the main message is that diabetes is associated with other hypertension, and this combination is a fertile land for the cardiovascular, atherosclerotic vascular disease to grow.
yes, sir. So thank you very much. So let me tell my viewers who are watching this program is what Dr. Jaikumar has explained, that diabetes is a disease of blood vessels. Though we call it as a sugar disease, ultimately it is because of the blood vessels get affected, our arteries, and that's why we get all the complications of diabetes like heart attacks, heart failure, paralysis, brain problems, kidney problems. Everything is related to your arteries. What Dr. Jaikumar is explaining is that with blood pressure, it is the complications of diabetes are not double, but they are 4 times higher. So a diabetic person, if his blood pressure is normal, 75% of his problems are solved. But if he has also blood pressure issues, then all his complications of diabetes like brain,
I think, madam,
heart,
some
are increased. So now we understand that these two things
with your
together,
audio. Is there any other?
I think let's keep everyone's mic mute when we are not speaking. Sanjay, can you just mute yourself?
Dr. Shailaja, I think Dr. Jaikumar connection is also poor, so his audio is not very clear. And Dr. Sanjay Reddy, please keep your mic mute when you are talking somewhere else.
Yeah, yeah. So actually that helps. So if everyone will speak by unmuting themselves, so that makes the thing simpler, and then we can talk about it. So now let's come to a very common question which everyone has in mind. What should be my blood pressure? And there is a very common way that people describe my blood pressure is 170 by 90, but this is okay for my age because I am 70 years old. Is there something like this? As the age goes up, we give concession that the blood pressure is also okay. So what should be the target blood pressure to be maintained? Especially someone has a type 2 or type 1 diabetes, what should be the ideal blood pressure of that person? Can we have just one or two figures, sir, Professor Jaikumar or Bansi, sir, if you can answer?
Okay, I think that's a very pertinent question to be understood by everybody, because good day those when I was a medical student about 50 years ago, I was told that the statement, as you grow older, your blood pressure will also be higher. You have to give allowance for your age. And once the classical teaching and my student days was 100 plus age is a systolic blood pressure is normal. That means if I am 70 years old, 170 is normal for me. But that is no more acceptable now, because so far so many research and papers have said it has been found out that as you grow older, your systolic pressure goes up, and that has to be taken into consideration to be corrected. Because if you look at the charts showing the age bar and the systolic blood pressure, as age advances from 50, 60, 70, it is important to keep them also within the normal range. The systolic blood pressure becomes the major problem. Whereas in the age of 40 and 50, it may be the diastolic blood pressure which is much more significant. But as age advances, it is a systolic blood pressure which is the most important thing. And second thing is, there are so many, see, every year and all this American Heart Association, European Heart Association, all come out with the guidelines, and there is hypertension guidelines coming. There will be some alteration in the values. But taken for granted, the usual thing is that 140/90 is taken as a cutoff point for a normal person to say that you are not, you are okay. If your blood pressure is less than 140/90, okay, you are all right. You don't require the pharmacotherapy. But conditions like diabetes, the cutoff point is little more lower down. Because when you start treating diabetes, hypertension in a diabetic patient or a chronic renal failure patient or a post-transplant patient, whatever it is, the cutoff point comes down. So it is for a normal person without any comorbidities, without any risk factors, 140/90 is all right. Whereas for others, you have to keep it a little more lower down. Then when will you say that you are hypertensive? Diagnostic criteria. There is a condition. People say that pre-diabetes. See, 130 high normal. Some people say 130, more than 130 to 140 is high normal for a diabetic patient. Then diastolic 85 to 90 high normal. Some people call it as a pre-hypertension phase. That is 130, 140 systolic, and 85 to 90 diastolic is taken as a pre-hypertension, and more than 140 there is a. See, these are all important because all the guidelines put the cutoff, because when you start therapy, pharmacotherapy for your patient, So many factors are taken to consider for defining the blood pressure and to say it is normal or not. If you are a diabetic patient, it must be more than 140/90. It requires a hypertensive therapy. Whereas if it is a normal person, you may be given, a non-diabetic patient may be given some more time allowance to do the lifestyle changes to see whether there is an important things or not. Then the other thing you said about type 1 and type 2 diabetes, you said, the thing is that hypertension in a type 1 patient is usually secondary to long-standing diabetes producing renal damage and getting hypertension. So it is usually when the person gets type 1 diabetes, they don't have hypertension, and the hypertension usually come after a few years of uncontrolled diabetes or whatever damage to the kidneys occurring, and then you get hypertension. Whereas in type 2 diabetes, it is a common fertile soil disorder, the vascular disorder. It can come even at any time. It can come even before diabetes, hypertension, or along with diabetes, or after some years of that. So hypertension and type 2 diabetes are having almost same pathology, can come anytime. Whereas in type 1 diabetes, it is always, or majority of time, it is secondary to a long-standing diabetes producing renal damage, nephropathy, and getting diabetes. That is about this. Then treatment-wise, I think there is a lot of time to discuss all those things. But cutoff point is 140/90, and some take it as 130/85 and above as a pre-diabetes, and 40/90 is diabetes.
Yes, sir. Thank you. Perfect. So now everyone has understood that 140/80 or 140/90 is the ideal blood pressure. And there is something called as pre-hypertension. And by government surveys, Maharashtra and Bengal are having, which comes with the modern lifestyle. So that is also not good. Yes, Dr. Bansi Sabu, you want to add and tell our viewers about this. Please go ahead.
अब तक के तो मैं आज आपका बहुत बहुत धन्यवाद कह रहा हूँ। ये प्रोग्राम हमने बाइलिंगुअल इसलिए रखा है कि कुछ लोग हिंदी में भी हमको फॉलो करते हैं और कुछ इंग्लिश में। RSSDI हमारी डायबिटोलॉजी की सबसे बड़ी ऑर्गेनाइजेशन है और हमारे को हर इस समय RSSDI सोशल मीडिया पेज पर कम से कम 10,000 लोग रेगुलर फॉलो कर रहे हैं। डॉक्टर आरवी जय कुमार ने जो बात की कि डायबिटीज और हाइपरटेंशन एक दूसरे के कजिन है, डॉक्टर शैलजा काले ने उसको बहुत अच्छी सुंदर तरीके से बताया कि ये दोनों बीमारी हमारे को वास्कुलर कॉम्प्लिकेशन, हार्ट अटैक, ब्रेन अटैक या किडनी फेलियर को करते हैं। और 140 और 90 जो उन्होंने मात्रा बताई है, वो ब्लड प्रेशर यदि उससे ऊपर है तो डेफिनेटली ब्लड प्रेशर है। और डायबिटीज के पेशेंट अकॉर्डिंगली यदि उनको और कोई साथ में तकलीफ है तो उनका टारगेट कुछ दूसरा रख सकते हैं। आज हमारे साथ डॉक्टर कमलाकर त्रिपाठी जुड़ रहे हैं जो बनारस से हैं, लेकिन कुछ मेरे ख्याल से कुछ टेक्निकल प्रॉब्लम्स के कारण वो अभी तक जुड़ नहीं पाए हैं, लेकिन वो नेफ्रोलॉजिस्ट भी है और डायबिटोलॉजिस्ट भी है, यानी डायबिटीज के स्पेशलिस्ट भी है और ब्लड प्रेशर के स्पेशलिस्ट भी है। इसलिए यदि वो जुड़ गए हैं तो मैं उनसे भी जरूर चाहूंगा। लेकिन डायबिटीज और हाइपरटेंशन एक बहुत इंपॉर्टेंट और कॉमनली एनकाउंटर बीमारी है जो हमारे बहुत सारे दर्शकों को हो सकती है या आपके परिवार में किसी को हो सकती है। ज्यादा जरूरत इस बात की जानने की कि दोनों बीमारी एसिम्प्टोमेटिक है, पेशेंट को अर्ली स्टेज में कोई तरह की तकलीफ नहीं होने के कारण, लेकिन कई तरह की बीमारियों को जन्म देती है, कई तरह के कॉम्प्लिकेशन होता है। इसलिए अर्ली और एग्रेसिव कंट्रोल होने से काफी हद तक हम जो कॉम्प्लिकेशन इनसे होते हैं उनको रोक सकते हैं। अगेन बैक टू डॉक्टर शैलजा। थैंक यू।
यस यस, धन्यवाद डॉक्टर बंसी। एंड आपने बहुत इम्पोर्टेंट पॉइंट बाद में दोहराया है एंड आई थिंक दिस इज वेरी इम्पोर्टेंट। एक और बात डॉक्टर जय कुमार ने सबको बताई है कि जैसे आपकी उम्र बढ़ती है आपको कंसेशन नहीं है। मेरी उम्र 70 है तो मेरा 170 ब्लड प्रेशर नॉर्मल है, ये जो हमेशा की समझ है ये बिल्कुल गलत है। सो कोई भी उम्र हो, ब्लड प्रेशर हैज टू बी बिटवीन 140 and 80. I welcome our senior colleague, Dr. Kamlakar Tripathi. Oh, again, I think we are just losing him every now and then. So there is one more, I will pass a comment about this, that when we say कि आपकी diabetes control में है या नहीं है, so when is your diabetes is under control? It's not only sugar. You need to have 3 things under control, A, B and C. So A is your A1C, sugar, B is your blood pressure, and sees your cholesterol. So unless your blood pressure is under control, we do not say that your diabetes is under control. So Dr. Jaikumar, can you just elaborate that if we control blood pressure, are we going to decrease complication in a major way? Suppose there is a person of diabetes, the benefit that person is enjoying by blood pressure control is much more than the sugar control. So a person needs to be extremely careful about his diabetes, and if he needs to take a tablet, he should not be getting fear of these BP tablets. So taking the tablets regularly, or we typically call it as a compliance. So yes, Professor Jaikumar, can you say this compliance of taking tablets is extremely crucial in diabetes management? Can you have few words about how compliance is important? Taking tablets regularly.
Yes, as Madam said correctly, the compliance is the main problem. Of diabetes. See, you and I see so many diabetic patients, and we prescribe the best drugs, but at only 30 to 35% people will come back with a good control, and the rest don't come back, and we are forced to increase the dose of the tablets and all those things. But if you spend little more time and they spend a little more time in finding out why these blood sugars are not being controlled, you will be astonished to find that many a times the patient will not be taking as usual. Or, in our country, the what is called alternative medicine is so strong. They will put the ideas in their mind that taking too much of medicine will damage your kidney, and don't take the tablets for a long time, it will damage the kidney and all those things. So if you actually, a study has been done, the complaints in America also, they also found that this is not only present in Kerala and India, it is present even in America. Even people have go and say that I have taken insulin, but they found out where to buy the insulin. So no insulin was sold at that for that patient. So like that, compliance is a very important thing. So one of the few reason for compliance, one is the number of tablets. The people think that if you take more tablets, more damage to because these are all modern medicine tablets. Second thing is, it is a cost factor maybe there. They may not be able to afford all this cost because some of the doctors don't look into their purse and the financial status before starting prescribing it. Because one of the important things is the financial status of the patient before you start prescribing a drug, so that you are sure that that patient will take the drug with the correct continuously till he sees you. So these are things which some of our doctors don't apply much pressure on it to decide these things. And so number of tablets, cost factor. Third thing is the fear factor. But we must be able to convince the patient that taking tablets, nobody's kidneys will be lost by taking an oral hypoglycemic drug. But not taking the tablets, having a high blood sugar will definitely damage your kidney. If you and our Rssdi can spread that message in our community, I think that will be the biggest help that we diabetologists are going to get by improving the compliance. Because I don't know what about in the North India. In Kerala, the main thing is every third person will come and ask you, so I'm taking the tablets, so I'm going to lose my kidneys, I don't want to take tablets for a long time, and like that. This is the main thing. So that is one thing. Second thing is the regularity. You must tell the patient that now the ideal blood sugar must be told to them. They must know that the ideal blood sugar is fasting around 110, 120 and all. Post 2 hour postprandial around 160, 180. At least it never should not shoot about 180 and never touch 200. And third thing is, we must tell them that if you can do hemoglobin A1C once in a while, it must be around 7, even though we don't able to get 1.5. If you can convince these three things, and the patient knowing that where should be the fasting blood sugar around 110, 120, 2 hour post around 160, 180, and a hemoglobin is around 7.2. If you can convince that message to our public, that is a big thing. And the third thing to is that we must always try to reduce the number of tablets, because compliance is very important. And good old days, our Indian subcontinent is the main place. Indian doctors and Indian pharmas were the number one in making the combination of metformin in with sulfonylurea and all those things. And we were in 1960s, we were used to be looked down by the Westerners, saying that, oh, you people are expert in making cocktails. But now I think everybody is accepting that combining two types of drugs in one tablets will improve the complaints, because they will see that he is only taking one tablet, taking two medicines in the same tablets. So likewise, so I think main thing to improve is the fear of drugs taking for a long time going to damage. Second thing is affordability of the drugs which we prescribe. Third thing is try to cut down by adding the proper combinations of drugs, so that the number of tablets taken will come down. If you can apply these three, I think we'll be able to get and improve and convince the patients, or at least convince them what are the normal values where they are expected to keep these blood targets. If you can come, this is about diabetes. I think hypertension will come later on. What are the targets?
Thank you, Professor Jaikumar. So I think my viewers have understood that taking tablets regularly, not missing the tablets, is crucial to prevent your heart, kidney, and the brain problems. So if your doctor has prescribed you some medicines, do not have undue fear. उसमें डरने की बात नहीं है, ये टैबलेट्स अच्छी होती हैं. अगर आपके पास डर है तो आप जाके डॉक्टर से ज्यादा बात कर सकते हैं, आपके सारे क्वेश्चंस रिजॉल्व कर सकते हैं. पर अगर आप टैबलेट रेगुलरली नहीं ले रहे हैं तो आपकी कॉम्प्लिकेशंस को कंट्रोल में रखना मुश्किल होता है. Many times we see patients come after 3 or 4 months, they just continue diabetes medicines and stop all other down medicines of blood pressure, cholesterol, which is very bad. So taking tablets of blood pressure regularly is very important. Now, one more very important point, Professor Jaikumar, I want to ask you is that nowadays with COVID, everyone has a blood pressure machine at home more. Previously also it was there, but now everyone is using it very regularly, which is very good, so that people are aware. But now if someone is using home monitoring of blood pressure, what time they should check their blood pressure at home? Is there a particular time? Is there a schedule that they should check their blood pressure at home? What will you advise?
That is a good question, because nowadays machines are available freely, and the cost factor is also much better. Many people are taking. The problem is that there are advantages and disadvantages. The majority of patients has an advantage, but some other patients are so much studious about the big one shot of blood pressure 140, 145, they will phone the doctor and disturb your sleep, saying that my blood pressure is gone up. So that is also there, too much of fear. But the thing is that always make sure that the person who is taking it knows to the correct technique, because it is all sensors and not like the doctor is oscillating the sounds, and here it is all sensors. So the sensor must be told where the sensor is in the it must be over the arterial, near the arterial surface, so that the sensing will be complete. So technique. Second thing is what time of the day. So I'll always ask the patient that relax. The best time on getting up in the morning is the best time where you have the lowest the blood pressure in 24 hours. And if you are going to do it in the later part of the day, it must be after the patient takes at least 5 to 10 minutes of rest, relax, and then only take the blood. This the two things is one thing is in the morning after a good sleep, you are getting up, you can do the blood pressure in the morning. Or if you are doing at the other part of the day, make sure that the patient sits for at least 5 to 10 minutes, relax properly, and do the test. And when he is anxiety, tension, then there is a bad news here. Don't go and check the blood pressure. That is going to be a little higher. And minute changes. The main thing is if you are saying that 140, 90, it will become 144. Don't jump to oh, mine is gone up, and don't call the doctor. It will take time. You repeat the blood pressure after 10 minutes, after 15 minutes, after relaxation, it will be much more pleasure. Even in the hospital clinic, what we say, some of the patients' blood pressures are high. They call it as white coat hypertension and all those things. So they relax it And that does not mean that all the patients are like that. There are patients whose blood pressures are fluctuating. That's a very small number of patients who have got a very labile blood pressure due to endocrine causes and all those things, which we may have to tackle seriously. But as a whole, as Dr. Shailaja Madam said, majority of patients looking at home take in a completely relaxed phase, and finally, technically, with somebody doctor's advice, find out the correct technique and to sensor make sure that the sensor is over the artery correctly and do the blood pressure recovery.
यस सो आई थिंक सबको बात समझ में आ गई है. घर में आप ब्लड प्रेशर चेक कर रहे हैं, आपकी मशीन अच्छी चाहिए, टेक्निक करेक्ट चाहिए. अर्ली मॉर्निंग व्हेन यू गेट अप, जब आप नींद खुलती है, द फर्स्ट थिंग इफ यू चेक ब्लड प्रेशर, इट्स अ गुड पैरामीटर फॉर डॉक्टर्स to decide. Also in the evening at 8 o'clock, again if you check your blood pressure, so if you plot it in your whatever apps or the notebook, it becomes easy for a doctor to manage your medicine. So checking of blood pressure at home is a very good idea, and you should do that. I will also take in between questions from the audience. Again, the important point. सिर्फ एक बात मुझे पहले करनी है. Dr. Bansi, are you there? Can I ask you a question?
यस यस वेरी मच.
बहुत सारे लोग हमसे कहते हैं कि जब हम सिर्फ जैसे डॉक्टर बंसी के केबिन में जाते हैं तो हमारा ब्लड प्रेशर बढ़ता है, घर में हम चेक करते हैं तो ब्लड प्रेशर एकदम नॉर्मल होता है. तो दिस वी कॉल इट एज अ, डॉक्टर का व्हाइट कोट देख के उनको ब्लड प्रेशर ऊपर जाता है, सो वी कॉल इट एज अ व्हाइट कोट हाइपरटेंशन. सो डॉक्टर बंसी, विल यू लाइक टू हैव अ कमेंट अबाउट इट, व्हाइट कोट हाइपरटेंशन?
ये आपने बहुत ही सही सवाल किया है, जो काफी लोगों को है. और कई बार पेशेंट हमारे को ये कंप्लेन भी करते हैं कि जब डॉक्टर साहब हम आपके चैम्बर में हैं तभी हमारा ब्लड प्रेशर बढ़ा हुआ है, घर पर तो नॉर्मल आता है. और इसको हम व्हाइट कोट हाइपरटेंशन भी कहते हैं. लेकिन व्हाइट कोट हाइपरटेंशन डायग्नोज करने के लिए हम एम्बुलेटरी ब्लड प्रेशर मॉनिटरिंग, और जैसे अभी डॉक्टर साहब बात कर रहे थे और आप बता रहे थे कि हम सेल्फ मॉनिटरिंग ऑफ ब्लड प्रेशर भी करना चाहिए, तब हम ये कंफर्म कर सकते हैं कि ये सही में व्हाइट कोट हाइपरटेंशन है. लेकिन व्हाइट कोट हाइपरटेंशन भी उन लोगों को होता है जो प्रोन टू डेवलप हाइपरटेंशन है, यानी जिनको ब्लड प्रेशर आने की संभावना ज्यादा है, और वो जब डॉक्टर के चैम्बर में आते हैं उस समय उनका ज्यादा बढ़ गया है, लेकिन बाद में उनका नॉर्मल है जो टारगेट रेंज के अंदर है. उस समय हम उनको शायद दवाई नहीं देते हैं, लेकिन लाइफस्टाइल मॉडिफिकेशन तो उनके लिए बहुत जरूरी है. तो डायबिटीज और ब्लड प्रेशर दोनों ही बीमारी काफी हद तक रोकी जा सकती है. डायबिटीज तो काफी हद तक रोकी जा सकती है, लेकिन ब्लड प्रेशर के पेशेंटों को भी हम कह सकते हैं कि ये प्रिवेंट कर सकते हैं मेडिटेशन से, सॉल्ट इनटेक कम करने से. और जिन लोगों को फैमिली हिस्ट्री है स्ट्रांगली, वो अपना रेगुलर चेकअप करें. और सेल्फ मॉनिटरिंग ब्लड प्रेशर काफी हद तक हमारे लिए फायदेमंद होती है जब हमको ये डायग्नोज करना होता है कि व्हाइट कोट हाइपरटेंशन है या इनको ट्रू ब्लड प्रेशर हाई है.
Yes, so Dr. Bansi is informing us that even blood pressure, if it goes high, only in the doctor's clinic, which is described as white coat hypertension, is not good. So, जिन लोगों को डॉक्टरों को देख के ब्लड प्रेशर बढ़ती है, उनमें भी there is a risk of complications are slightly higher than the people who have a normal blood pressure. So, क्योंकि दिन में ऐसे बहुत सारे moments आते हैं जब आपका ब्लड प्रेशर ऊपर जा सकता है, और जितना भी टाइम ब्लड प्रेशर हाई है, योर हार्ट इज वर्किंग अगेंस्ट मोर रेजिस्टेंस, your kidneys are getting affected by high blood pressure, your blood vessels are getting affected. So whatever number of time your blood pressure remains high, maybe by seeing a doctor, maybe in the traffic, maybe under the stress, it is not good. And there are a lot of ways, just as Dr. Bansi was mentioning just now. Now there are a lot of tests, but I will also like to have only one very important question to Dr. Jaikumar before we go to the treatment aspect. I want to ask him that is one test which all doctors ask patients to do, is the amount of albumin in the urine, which is very, very important, especially when there is a diabetes and blood pressure together. So that small amount of albumin in the urine, it is bad. So patients has to go these yearly tests. So can you just in a very short answer say, if Dr. Tripathi has joined, sir, can you, am I audible to you, Dr. Tripathi?
Yes.
Yes.
Yes, sir. So welcome here, and we are privileged to have Dr. Tripathi here. Sir, आप बता सकते हैं maybe in Hindi or English, your patients and viewers are listening to you that the kidney and blood pressure and diabetes, they are together. The earliest sign is slight high blood pressure and a small amount of urine protein which comes in the urine.
I agree totally. When the diabetes start, renal perfusion and the microcirculation bed. So as the process start of diabetes close to 10 years before the clinical onset of dysglycemia, what we can perceive in the form patient comes to the doctor, the microproteinuria starts only after patient becomes occult diabetes, after becomes overt diabetes. Then there's the microproteinuria. So standard postgraduate teaching long back was in the beginning of our career. Whatever means you adopt, you control blood pressure. By that controlling, the proteinuria would be automatically be taken care of. Now we understand that the moment the ARBs and AC enzyme converting enzyme inhibitors came, it started with captopril. Slowly they started also improving upon the proteinuria. Proteinuria is not a hallmark that patient would deteriorate fast, but it's certainly a hallmark that patient can develop endothelial dysfunction, patient can develop now congestive heart failure, patient can be a potential candidate for any other procoagulant state. All these would lead to some damage slowly on the endothelial bed and ultimately can lead to overt proteinuria. So from covert proteinuria, it becomes the overt proteinuria. So to all both treatment, whatever improves endothelial function, the podocyte and the membrane permeability and the afferent arterial pressure, all the three contribute to proteinuria. It's the intraglomerular hypertension which contribute to the proteinuria. It's the afferent arterial pressure which contribute to the proteinuria. It's the endothelial dysfunction which contribute to the proteinuria. It's the perfusion pressure which contribute to the proteinuria. And therefore, a good control of the blood sugar would retard. ये हमने टाइप 1 डायबिटीज में DCCT ट्रायल के बाद हमें ये पता चला. And that was the hallmark trial which taught us that when you meticulous control the blood sugar, starting from DCCT in type 1, then came to the UKPDS, then came to Steno 2 trial. ये सभी ने बताया हमको कि अगर बढ़िया से हम कंट्रोल कर सकते हैं ब्लड शुगर तो प्रोटीनयूरिया भी कम होगा. एक तो ये. दूसरा, ब्लड शुगर के साथ साथ ब्लड प्रेशर भी. कैल्शियम चैनल ब्लॉकर सबसे पुराना हमारे पास है. Now newer calcium channel blocker work on the podocyte. So they also help in the podocyte effacement and prevent proteinuria. Number 3, the drugs ACE converting enzyme and ARBs who work on the fibroblast growth factor, as well as they work on the different signals which modify the perfusion pressure. इनके साथ भी एडवांटेज है. वी हैव एडवांटेज ऑन विद दिस यूजिंग दीज टू पोटेंट AC inhibitors and ARBs. They also take care of blood proteinuria. तो अभी जो हम लोगों के पास एविडेंस है वो ये है कि अगर बहुत रीनल फंक्शन का डेटोरेशन नहीं हुआ, ग्लोमेरुलर स्क्लेरोसिस नहीं हुआ, फिल्ट्रेशन बेड हमारा ठीक है, तो ब्लड प्रेशर कैसे भी कंट्रोल करेंगे, प्रोटीनयूरिया कंट्रोल होगा. प्रेफरेबली ARBs, एंजाइम इनहिबिटर और उसके कॉम्बिनेशन में जो न्यूअर कैल्शियम चैनल ब्लॉकर हैं हमारे पास, ये भी they work on the podocyte. So we can choose some of the 4th generation of calcium channel blocker. We can choose the azidipine, which is newer one. We can choose selendipine. all these would be able to take care of the podocyte filtration effacement as well as the intraglomerular modulating hypertension. So a
Yes, sir.
meticulous control of blood pressure by ARV combination, maybe calcium channel blocker, and a good glycemic control together would retard the excretion of protein from the urine and would prevent the kidney.
Yes,
Dr.
thank you,
Kale.
Dr. Yes, thank you so much, sir. And I think in a very short span, he has actually explained very nicely to all the physicians and doctors also. तो लोगों के लिए बता रही हूँ मैं कि गुड ब्लड प्रेशर कंट्रोल और कुछ कॉम्बिनेशन ऑफ ड्रग्स जो आपके डॉक्टर आपके लिए लिखते हैं ये बहुत इंपॉर्टेंट है किडनी के पोडोसाइट को इंजुरी से बचाने के लिए और फिर प्रोटीनूरिया कम होता है क्योंकि डॉक्टर त्रिपाठी अभी हमारे साथ जुड़े हुए हैं मेरा नेक्स्ट क्वेश्चन है वो सभी के मन में होता है विच इज salt sensitivity in the population. So, and there are even last year in European Society of Cardiology, very good studies published in a particular area when the salt intake was reduced in the population, then lots of problems were reduced. तो मैं आपसे पूछना चाहती हूँ प्रोफेसर त्रिपाठी कि ये जो नमक का इंटेक होता है द सॉल्ट इंटेक डेली सॉल्ट इंटेक इससे क्या फर्क पड़ सकता है ब्लड प्रेशर में क्या आप बता सकते हैं हमारे व्यूअर्स को
जी नमक जो है हमारे लिए दो तरह के जैसे आपने बताया एक तो साल्ट के प्रति बहुत संवेदनशील साल्ट सेंसिटिव हाइपरटेंशन एक वो लोग हैं जिनमें की नमक की मात्रा इंट्रावेस्कुलर कंपार्टमेंट में जहां पानी रुकता है हमारे शरीर में वहां भी बढ़ सकती है आरबीसी मेम्ब्रेन में भी हमारा नमक प्रवेश कर सकता है इससे हमारा आरबीसी का वॉल्यूम भी थोड़ा बढ़ता है और आरबीसी की थोड़ी सी हाइपर कोएगुबल स्टेट भी होती है हमारी और थोड़ी आरबीसी की रियोलॉजी जिसको हम कहते हैं उसकी मॉर्फोलॉजी में भी इफेक्ट आता है ये तीन कंपोनेंट है अब ये जो साल्ट सेंसिटिव लोग हैं इनका साल्ट इंटेक जहां भी 2.5 ग्राम से 5 ग्राम तक ये नॉर्मल से आगे बढ़े ये एक्स्ट्रा साल्ट जो गया इसने हमारा इंट्रावेस्कुलर वॉल्यूम भी बढ़ाया इसकी वजह से हमारा पेरिफेरल रेजिस्टेंस भी बढ़ा इसकी वजह से आरबीसी के अंदर परमेबिलिटी बढ़ गई सोडियम की सोडियम लिथियम परमेबिलिटी कहते हैं इसको हम लोग मोटे मोटे तौर पे और ये सब मिला करके पेरिफेरल रेजिस्टेंस बढ़ा देते हैं तो ये जो साल्ट सेंसिटिव पॉपुलेशन है हमारे पास पैरामीटर्स हैं और अब हमारे पास बायोमार्कर्स हैं जानने के लिए हमारे पास मॉलिक्यूलर बायोलॉजी के हिसाब से हम बता सकते हैं प्रेडिक्ट कर सकते हैं कि कौन से लोग साल्ट सेंसिटिव होंगे ये उन पे भी डिपेंड करता है कि इनका कॉर्टिकल नेफ्रॉन और मेडुलरी नेफ्रॉन की पॉपुलेशन कैसा है अगर आपके पास दो नेफ्रॉन का पॉपुलेशन एक में लूप ऑफ इनले बहुत लंबा होता है उसका सरफेस एरिया बहुत ज्यादा होता है तो ज्यादा सरफेस एरिया वाले के पास ज्यादा साल्ट एब्जॉर्ब करने की कैपेसिटी होती है इसलिए ये थोड़ा भी साल्ट खाएंगे तो वो साल्ट जल्दी से ले लेंगे और इसलिए उसमें इसकी गुंजाइश नहीं होती है हमारे पास ड्रग्स भी ऐसे ही हैं वो ड्रग्स भी हमारे इन पेशेंट्स के लिए बहुत महत्वपूर्ण है क्योंकि हम करीब करीब 75% से 80% हमारा जो साल्ट है वो प्रॉक्सिमल ट्यूब्यूल से हैंडल होता है सिर्फ 15 to 20% साल्ट हमारा डिस्टल ट्यूब्यूल से हैंडल होता है तो जो लोग का प्रॉक्सिमल ट्यूब्यूल से रिलेटेड बीमारी है जेनेटिक बीमारी भी है ससेप्टेबिलिटी भी है ये सारे लोग नमक ज्यादा अवशोषण कर सकते हैं ज्यादा नमक शरीर में उनके चला जाएगा लेकिन जिन लोगों का ये नहीं ये प्रॉक्सिमल ट्यूब्यूल में S1 S2 सेगमेंट में वो जीन का दिक्कत नहीं है उन लोगों में ऐसा नहीं होगा इसी आधार पे हम डायबिटिक भी चूज करते हैं
Yes. So it is very important to control salt intake in everyone's diet. I think everyone agrees. And by simple controlling salt, which goes very high in bakery products, ready-made products, frozen food. So ये जो हम कहते हैं घर का खाना खाइए. So all of ready-made products, food products, they have very high salt content because salt is used as a preservative. So cutting down the salt in a daily diet is extremely crucial, I will say, as a first step to control blood pressure, and also आपकी blood pressure की दवा कम करने के लिए इसका बहुत फायदा होता है. My next question is to Professor Jaikumar. Can you tell the role of exercise, a daily routine exercise for the control of blood pressure? उससे क्या फर्क पड़ता है blood pressure में? क्या आप can you just elaborate on this, Professor Jaikumar?
Can you just once more clarify the question?
What is the role of daily routine exercise in control of blood pressure?
Sure. I think you have said that management of diabetes and hypertension especially, there is a just like diabetes management, lifestyle changes are very important. And already Madam has told about, and Professor Tripathi has mentioned about the diet, the salt intake and the control. The next important thing is the exercise. It is easy to preach but difficult to practice. If you ask your patients, you have at least 20 minutes of exercise every day. Not only good for diabetes control, for blood pressure control, relaxation of mind, everything for a healthy living, healthy metabolism of all this body. 20 minutes of regular exercise is good, but very difficult to advise. It is easy to advise, very difficult to get it done, because our system, at least we say that at least 5 days a week at all. I always tell, see, your system is working 365 days in a year, so why do you want to cut short? You are going to give an exercise, give it every day. But the duration exercise around 20 minutes will be nice. And the second question is the best and what is the best exercise? It must be cost effective and without spending money. So you can go to the gymnasium and do some exercise and all. You have to go give the fees to the gymnasium. You have to go there if there is. The most important which you can do in your house is do some little bit of walking. Usually, but for the COVID containment, so on other areas people can freely walk. There is no expenditure involved in it. 20 minutes of walking. If you can not do it in the road or the ground where it is safely, you can do it. You can at least do it in your house. Do steps up and down. 20 minutes of little bit of brisk walking will definitely improve the blood pressure control, relax your mind. How does it work? Because when you do exercise, some of the hormones are released which will have vasodilation and improve the reduce the toxics like interleukins and improve the favorable hormones which will affect the endovascular endothelium and relaxation. And the mind relax, your blood vessels also relax, and the blood pressure also goes down. So 20 minutes of some form of exercise is advisable, but very difficult to get it done every day. At least you say, at least you get it after 20 minutes, at least you cut it down to 15 minutes and do it every day. And don't cancel it because of the season or because the blood pressure is there around the year, whether it is raining or not.
Yes. Thank you so much. So मैं आपको ये दोहराना चाहूँगी कि exercise has a very crucial role in control of not only sugar but your blood pressure. There are different combination of exercise is the key. So आप aerobic exercise करो जिसमें आपके pulse rate थोड़ा सा बढ़ता है, which is good for your heart, good for blood pressure. Then there is a muscle strengthening exercises which Professor Jaikumar is saying go to the gym. And these muscle strengthening exercises, even you start after 65 years of age, will help to reduce blood pressure. The biggest effect of muscle strengthening exercises is on blood pressure. There are very good scientific studies which have shown that compared to aerobic activity, if you have additional at least twice a day muscle strengthening exercises, your blood pressure reduces. So your exercise should have a combination of all these three things. वन इज एरोबिक, जैसे आप क्या डॉक्टर प्रोफेसर जयकुमार बता रहे हैं, आपको वॉकिंग करनी चाहिए, आपको जिम में भी थोड़ा सा, घर में भी यू कैन डू मसल स्ट्रेंथनिंग एक्सरसाइजेस। और व्हाट ही वाज ट्राइंग टू एक्सप्लेन कि थोड़ा सा मन शांति, जिससे ब्रेन से जो इफेक्ट आता है, which it is also a type of exercise, as we call it as a breathing technique, or you can call it as a meditation, or you can call it as a pranayama. All these three combinations, breathing exercises in pranayama, walking, running, badminton like aerobic, and muscle strengthening. So if you have a combination, it has a great effect on the elasticity of your blood vessels, and which decreases blood pressure, आपकी नंबर ऑफ टैबलेट्स कम हो सकती हैं। Just one again question someone is asking, that what is the effect of weight loss on blood pressure? Dr. Bansi, you want to take this? Even a modest weight loss, because we see so many people do on diet programs, they lose weight and their blood pressure medicines are gone. So can you just tell me a few things about हमारे viewers के लिए?
So even the 5 to 10% weight loss is really very helpful for the metabolic control. So there are so many metabolic profile like dyslipidemia, lipids abnormalities, sugar, as well as the blood pressure, which all are non-communicable diseases. They all get reversed. So I mean, a modest weight loss of 5 to 10% help our patient, and this is if it is done by a lifestyle modification. It should be done on a long-term basis. So I mean, weight loss is not important. It has to be maintained also. If somebody is losing a weight of 5 to 10%, but it has to be maintained for long term, that is very beneficial. Otherwise, I don't think only losing the weight for a few days and some of them they again regain the weight. Rather, most of the time they gain the weight 1 kg more, whatever they lost. So I mean that is not good. So I mean a sustained weight loss plus a weight maintenance program, which is much more important for a long term, not only control of blood pressure but all other metabolic problems which one may have.
So perfect. So हमारे viewers को अभी exercise करने के लिए और एक वजह है, not only sugar but your blood pressure control. आपकी बीपी की गोली कम करनी है, start doing exercise. अभी मैं मेरे सामने बहुत सारे क्वेश्चंस भी हैं, तो पहले मैं सिर्फ मेंशन करती हूँ, हमारे एक भाई साहब हैं मिस्टर पारस शर्मा, उनके बहुत सारे सवाल आ रहे हैं अबाउट ब्लड शुगर लेवल्स, use of insulin, why Indian doctors are not checking C-peptide insulin. मैं उनको नमस्ते करती हूँ, आपके सारे सवालों का जवाब देना हमें बहुत अच्छा लगेगा, बट आई एम एक्सट्रीमली सॉरी मिस्टर पारस शर्मा, आई कैन नॉट इंक्लूड योर क्वेश्चंस टुडे बिकॉज टुडेज टॉपिक इज ब्लड प्रेशर एंड डायबिटीज. सो इवन हम सब सी पेप्टाइड करते हैं, इंसुलिन करते हैं, एंड पारस शर्मा को गुस्सा भी आ रहा है कि दिस इज अ फ्रॉड एक्सेट्रा एक्सेट्रा एक्सेट्रा. सो भाई साहब, आई एम सॉरी, टुडे आई कैन नॉट टेक दीज क्वेश्चंस. I'm requesting Dr. Bansi, who is our president, to keep a whole 1 hour session on all your questions. We are very happy to discuss and answer that. So today, please.
हमारे वो सोशल मीडिया पेज के ऊपर जो भी उन्होंने सवाल किए हैं उसका हम आंसर उनको पर्सनली और वापस हम उसको चैट बॉक्स में आंसर कर देंगे. और इंडियन डॉक्टर जब सी पेप्टाइड की जरूरत होती है, जो टाइप 1 और टाइप 2 को डिफरेंशिएट करने की होती है, वो जरूर से करते हैं. शहर में डॉक्टर ज्यादा कॉमन करते हैं, गांव में सी पेप्टाइड का वैल्यू एस्टिमेशन करने की लैब में फैसिलिटी कम होने के कारण या पैसा ज्यादा होने के कारण नहीं करते हैं. और इंडियन डॉक्टर्स दुनिया के सबसे कॉस्ट इफेक्टिव और सबसे ज्यादा मेहनती और आपके एक फोन कॉल अवे डॉक्टर है, जबकि दुनिया के कोई भी कोने में आप चले जाइए, आपको डॉक्टर एक फोन कॉल पर अवेलेबल नहीं है और वो कॉस्ट इफेक्टिव नहीं है. तो मैं कहूंगा इंडियन डॉक्टर्स के लिए प्लीज, आई मीन यू डोंट टेल ऑन एनी सोशल मीडिया that Indian doctors are not doing this or not doing this. We are following all guidelines as per international guidelines. We are treating our patients for diabetes, for hypertension. This is my message.
Okay. Paras Sharma is happy that president of Rssdi is answering, and he will take a whole session on that. There is a question from Mr. Anchit Goel. He is asking that can anti-androgen drugs reduce blood pressure and diabetes? Yes, Professor Tripathi or Jaikumar, whoever wants to answer this question. The question is, can anti-androgen drugs reduce blood pressure and diabetes? Anti-androgen drugs.
See, if you want anti-androgen drugs, that rightly the main one which will come for the endocrinology is spironolactone. Spironolactone is a drug which is used by endocrinologists for treating hirsutism and acne and all those things. And as you know, this is a drug which has been discovered for treating hypertension. So naturally, if your patient is given the benefit of anti-androgen therapy for or some PCOD or some other problem, definitely that will have some effect on the blood pressure. So you got checking the blood pressure.
It's Dr. Jaikumar Dr. Jaikumar would be a suitable person to answer this question.
Yes, sir. Thank you so much. Dr. Jaikumar is answering. Yes, Professor Jaikumar, go ahead.
Yes, so I think so. If you are anti-androgen drug like spironolactone, because as you know, the nephrologist will be objecting because it is a drug discovered for by the cardiologist and the nephrologist for the handling this salt metabolism. But it was found out that it has got an anti-androgen effect, and that is being utilized by the endocrinologist for treating hyperandrogen states like PCOD and excess hirsutism and acne the body. And naturally that has got, so it cannot be considered as a standard drug for treating hypertension or diabetes. But if your patient has to have the benefit of anti-androgen therapy and you are prescribing the drug, keep in mind that you are getting one more added advantage of slightly reducing the blood pressure. And the cardiologists are
like some of the older drugs which we are not using now, alpha blocker.
Yes, I was going to say that. Yes.
Yes.
Yes, so I think Anchit Goyal sir, you got your answer from the experts. So I think we are very nearing the last few minutes of today's talk. So finally, there is one question by Mr. Sharma: 130 by 90 reduced to 120 by 80 blood pressure. So I will say 130/90 is good. There is no need to increase tablets to push down to by 120 by 80. But if someone's blood pressure is reduced by weight loss, and if it goes down, it is good for him. Not by increasing the tablets. 140 by 90 is a good range. Sanjay, do we have a time for, or do you want to end the
I
session?
think you have another couple of minutes. You can wind up for 15, another couple of minutes.
Yes, Professor Jaikumar, please go ahead.
Yes. What you said is exactly correct. But if you have blood pressure, some of the studies have renal and all those studies have shown that if you can keep it 120 systolic, you get a lesser left ventricular mass. You can reduce the left ventricular mass. You can reduce the stroke incident. But it is a J-shaped curve. If in a diabetic patient who had a stroke or a CVA in the past, if it goes below 120, it is a double-edged weapon. The chance of strokes will go up also. So that message you must give it to the public. So don't be too over-enthusiastic, especially in a patient who had a CVA in the past. Make sure that it does not go below 120 systolic. Chance of recurrence of stroke is there. J-shaped curve. Okay.
मैं वापस दोहराना चाहूंगी, अगर किसी व्यक्ति को ब्लड प्रेशर की बीमारी नहीं है, if he is a healthy individual, और फिर उसका ब्लड प्रेशर 110 और 70 है, तो दिस इज वेरी गुड. एक्चुअली इट शोज द लॉन्जिविटी कि वो ज्यादा साल रहेगा. बट इफ समवन हैज अ ब्लड प्रेशर और आप उसकी गोली ले रहे हैं, तो ज्यादा नीचे गोली लेके बीपी ज्यादा नीचे करना अच्छा नहीं है. टू मच लो इज नॉट गुड. बट अगर आप एक हेल्दी इंडिविजुअल हैं, आपको कोई भी गोली शुरू नहीं है, तो आपका ब्लड प्रेशर अगर 100 भी है तो भी आपके लिए बहुत अच्छा है. बट गोली लेके हमें इसे ज्यादा कम हम नहीं करते, वो आप आपके डॉक्टर के ऊपर छोड़ दीजिए. योर डॉक्टर विल टेल यू करेक्टली व्हाट शुड बी योर टारगेट ब्लड प्रेशर. सो आई विल जस्ट लाइक टू समराइज टुडे that we saw that blood pressure is very important in a person with diabetes. 80% of your problems of diabetes of heart and kidney and the brain will be reduced by controlling blood pressure. So control of blood pressure is crucial. इसमें चेकअप जरूरी है, घर में भी आप चेकअप कर सकते हैं. इसमें कंप्लायंस ऑफ मेडिसिन, जो भी आपके डॉक्टर ने लिखा है वो सही तरीके से लेना इज वेरी इंपॉर्टेंट. कंप्लायंस इज क्रूशियल. आपका डाइट, आपका सॉल्ट इनटेक, आपका टाइप ऑफ एक्सरसाइज, the mental relaxation, changing lifestyle is again crucial for blood pressure management. Anyone like to add something? Otherwise, I am giving this podium to Mr. Dr. Sanjay Reddy from Bangalore to have some comments and end the session by thanking my esteemed faculty today.
Thank you, madam. I got
Thank you,
one
Dr.
comment.
Shailaja.
Thank you.
Yeah,
One
yes, sir.
comment. One comment is that all said and done, we spend a lot of time in educating the public and the doctors. But the very sorry story is that only 46% of our diabetic patients are are detected to have hypertension, even though the 50% is not being detected. And if even after detection, only 40% of our diabetic hypertension are treated. I started treatment, and after that, only 15% are properly treated. So that is a state of affairs. So I request that all the diabetic patients going to the doctor insist on a blood pressure checking up and make sure that they don't have hypertension, because this is the percentage is very shocking. 50% not only 15 is being treated properly. Thank you.
Yes, thank you. Yes, Sanjay.
And at the outset, thank you, Dr. Professor Jaikumar, a past president of Rssdi. And I like the last statement on the statistics. Only 15% are treated adequately. And for those of our viewers listening, please make sure that you take your medicines clearly. Thank you, Dr. Tripathi, sir, for being with us, though there was a small technical hitch. And thank you, Dr. Shailaja, for doing the lovely moderation between both of them. And always our enthusiastic Dr. Bansi Sabu, who's actually the brainchild behind this program. A big hats off to you to think about it, and probably, and all the EC members for the support. Thank you very much, sir. It was very kind of all of you for taking this time. And thank you, all viewers. Please join us for the 17th edition of Rssdi Social Bytes next week, same time, same day. Thank you very much.
Bye.
Thank you.
Bye.
Bye. Bye,
Bye.
Fancy.
Bye bye. Bye, sir.
Bye,
Bye, sir.
Sanjay.
Bye, sir.